So if I take a look across each, income statement line item, salaries and wages and benefits are the most expensive. It's 60% of our revenue.
Yeah.
And when you start to think about that, you think about a couple of things. I mean, if you look at other organizations, technology may be a larger spend, and that's what's, driving their solution. For us, it's really people. I mean, that's who's delivering the healthcare. So you think about a couple of items. If you hear, maybe from surveys that nurses or other clinical teams may not be happy, and you start to dig into like why, that's something that you want to address, because if you don't address it, it's only going to cost you heavily in the future, right? And so one of the things that really resonated with us is just being able to have better flexibility, but we also have to have insight into our volume trends and demand and things like that, and make sure that we develop a productivity system that allows us to be able to meet that demand, with also making sure that we have a flexible staffing pool for our, for our clinicians and our nurses. I feel that that's something that I always have to invest in, because it's only going to get worse over time. So if you think about the fact that you have less nurses coming through nursing school, you have less professors being able to teach those nurses, and you got to think about some nurses not even being able to operate at the top of their license because they are doing work that are sort of non-nurse related, right? Like transporting. I don't need a nurse to transport a patient. I need a nurse to come in and have really good quality touches with our patients. So it's really important for us to invest there, because I know it will, one, make our workforce happy so we can have less turnover, and less turnover means, less cost, but also be on the cutting edge. We want to be able to be a great place to work, because we are in markets with other health systems that we have to compete with. And if we don't invest, they're going to leave us, they're going to go to our competition, and it's only going to hurt us from, being a great place to go for healthcare.